This video will describe what is avian flu, signs and symptoms of avian flu in humans, diagnosis, and its prevention. What is avian flu? Avian influenza is a disease that occurs in birds as a result of infection with avian influenza type A viruses. These viruses are found naturally in wild aquatic birds all over the world, and can infect domestic poultry, as well as other birds and animals. Wild aquatic birds include shorebirds like storks, plovers, and sandpipers, as well as water birds including ducks, geese, swans, gulls, and terns. Wild water birds are thought to serve as hosts or reservoirs for avian influenza A viruses, particularly dabbling ducks. Certain species, like ducks, may not become ill, despite contracting avian influenza A viruses in their intestines and respiratory systems. Avian influenza A viruses, on the other hand, are highly contagious among birds, and some of these viruses can sicken and even kill certain domesticated bird species such as chickens, ducks, and turkeys. Avian influenza A viruses can be found in infected birds' saliva, nasal secretions, and feces. Domesticated birds, chickens, turkeys, ducks, and so on, can become infected with avian influenza A viruses by direct contact with infected waterfowl, or other infected poultry, or through contact with virus-infected surfaces. Signs and symptoms in humans. Humans may develop symptoms, from a mild upper respiratory infection, fever and cough, to severe pneumonia, acute respiratory distress syndrome, shock, and even death from avian, swine, and other zoonotic influenza infections. During an H5N1 infection, gastrointestinal symptoms such as nausea, vomiting, and diarrhea have been observed more frequently. The virus that infects a person can vary in terms of the disease's incubation period, the severity of symptoms, and clinical outcome. High fever and cough are typical early symptoms, which are then followed by signs of lower respiratory tract involvement, such as breathing problems. Upper respiratory tract symptoms, such as a sore throat, are less common. Diagnosis. To detect human infection with zoonotic influenza, laboratory tests are necessary. WHO regularly updates technical guidelines for the detection of zoonotic influenza in humans, using molecular techniques like RT-PCR and other technologies, through its Global Influenza Surveillance and Response System. Prevention. In addition to antiviral medication, public health management involves personal protective measures such as regular hand washing and adequate hand drying. Maintaining proper respiratory hygiene, which includes using tissues and covering your mouth and nose when you cough or sneeze. Early isolation of those who are ill, feverish, or showing other influenza-related symptoms. Avoiding contact with infected people. Avoid touching lips, nose, or eyes,